Hello, my name is Blessed Now. I'll be a nurse today. So how are you doing today?
Good.
To quickly identify you, what's your name
And
date of birth?
July 4, 2009.
Okay, before I start, let me quickly sanitize my hands. So I'll be assessing your some part of your body today. So let me quickly assess your ear. Okay, there is no lesion, there is no discharge. Let me palpate. Yeah, auricle, yeah, trachea. Are you feeling any pain?
No.
And so, yeah, are you feeling any pain here?
No.
Okay, my patients do not feel any pain in any of the ears. So I'll be doing the three words whisper in your ear, in each of the ear.
Apple. Orange. IK. Luca. IK. Luca.
My patients do not have any hearing loss. So the next thing I'm going to examine your nose. The nostril is is symmetrically in midline. There is no discharge in the nose. So the next thing I'm going to do is to palpate the sinuses, the area of sinuses. First one is frontal sinuses. Are you feeling any pain on the frontal sinuses?
Nope.
Okay. And the maxillary sinuses. Are you feeling any pain on the maxillary sinuses?
No.
Okay. My patient will not feel any pain in each of in any of the sinuses. So I'm going to inspect the lip. I'm going to inspect the lip. The lip is highly hydrated, and there is no lesion. So the gum is pink in color. There is no bleeding. The teeth are intact, and they are white in color, and they are evenly spaced. Okay, my patient's tongue. The tongue is the base of the tongue is symmetrically midline, and open your mouth, please. The say okay. The upper and the hard and the soft palate are intact. When he say the uvula or the cranial nerve 9 and 10, they are very intact because he moved back and front. So the next thing I'm going to do is to examine the hypoglossal, which is the cranial nerve 12. Say light, tight, dynamite. Okay, the cranial nerve 12 is intact. So the next thing I'm going to do to my patients is to examine the neck. Okay, in examining the neck, there is no lesion, there is no swelling, there is no obvious enlargement of thyroid. The temperature is warm. So I'm going to palpate the carotid artery with my 2 hands in each side. You feel any pain here?
No.
Any pain here?
No.
Okay, my patient's carotid artery is rating 60 beats per minute, and there is no pain, there is no lesion, there is no everything is intact. So I'm going to do the spinal accessories. Turn your head to the left, to the right, shoulder short. Okay, there is no pain. My patient is not feeling any pain, no tremor, and the spinal accessory is intact. So the next thing I'm going to do is to examine my patient's upper extremity. Okay, there is no okay, I'm going to inspect there is no edema, there is no lesion, there is no pains. Are you feeling any pain?
No.
Okay, my patient is not feeling any pain on his in the both upper extremities. So we are going to do ROM, which is a range of motion. First of all, we are going to do the wrist, and I'll make sure that my patient's wrist is relaxed. So flexor, extremity. I'm going to do the elbow, flex, extremity. I'm going to do the shoulder, stroke, adduction, adduction. Internal rotation, external rotation. Okay. During the ROM, that's the range of motion. Did you feel any pain on any part of your body?
No.
Okay, my patient's upper extremity are intact. You didn't feel any pain. Okay, now I'm going to examine your nails. Okay, my patient's nails are clear and smooth. They're slightly rounded. So, both of the hands. So I'm going to prepare the pulse with my 2 fingers. Each one I'll say up to 1 minute. Okay. Second one. Okay. The both radial pulse is rating 60 beats per minute, and they're all strong, and they're equally bilateral. So the next thing I'm going to do is to examine your hand grip tight. Okay, my patient's hand grip was tight. They are strongly symmetrically bilateral. So the next thing I'm going to do, I'll quickly turn your back on me. Then I'll quickly check your chest expansion. Quickly check your chest symmetrical. Okay, there's no possession, there's no edema, there's no pain. Okay, now I'm going to palpate the symmetrical chest pain to see. Breathe in, out. Okay, my patient's chest chest expansion was symmetrically moving up and down, which is still intact. So I will quickly listen to his lungs, his breath, with my using a stethoscope, starting from the shoulder in the 9 places. Breath in, out. Breath in, out. Cough. Breath in, out. Okay, as I was listening to my patient's chest expansion, there was no wheezing and there's no crackle. So his lungs are very clear. So I'm going to listen to turn your front. I'm going to listen to my patient's anterior thorax chest. Okay, I'm listening to the respiration. In, out. In 5 places. In 5 areas. Okay, my patient's respiration was 14 beats per minute, and the respiration was smooth and even. And the next thing I'm going to do is to listen to my patient's ratio, anterior and posterior